The Washington Post is reporting that Central Ohio is currently facing a measles outbreak among school-age children. At least 81 kids have contracted the disease so far, and more than 24 have been hospitalized. According to data from the Ohio Public Health System, only 3 of the 81 children have received one of the 2 recommended vaccine doses. 76 of the children have not received a single dose of the measles vaccine. Joining us now, Health Commissioner for the City of Columbus, Ohio, Dr. Mashika Roberts. Dr. Roberts, thank you so much for joining us. It's sort of stunning. Measles, a disease that I think most of us thought was largely in the rearview mirror. To what do you attribute this uptick, and how much of it is to this more and more widespread anti-vaccine sentiment among many on the right?
Right. Well, thanks. Good morning, and thanks for having me. You're absolutely right. The United States declared measles eliminated in 2000, and here we are in 2022 with several measles outbreaks that have occurred over the last decade, and we're having a significant measles outbreak right here in Columbus, mostly among kids who were eligible for the vaccine, but whose parents chose not to get them vaccinated in a timely fashion. This sentiment of vaccine hesitancy, or vaccine reluctance, is growing in our community, and it's going to continue to spur outbreaks like we're having here if that were to continue across the nation.
Dr. Roberts, this is Eddie Glaude. Given what you've seen, what you've witnessed here with regards to measles, what do you make of its implications for public health policy broadly? When you have people who are concerned about their notions of liberty, their ideas of freedom, and really that trumps any concern for the public good. What does this mean, in your view, for how we think about public health, how we approach public health more generally?
Well, it's definitely threatening public health and the role that we play. And we saw this really intensify during the pandemic when many people started to make vaccines political. Vaccines should not be political. Vaccines have been around our country for decades, and they've really helped us reduce, if not eliminate, vaccine infections like measles, like pertussis, like polio. And so it is really challenging public health and what is our authority and what can we do for the population health. This isn't about individual health all the time. This is about population health. We have cases of measles here who have, been doing all the right things. Maybe they weren't eligible to get the vaccine yet, but they were in an environment where other children were present who had measles, who had not been vaccinated. And so now that is threatening those families, those children who, again, are doing all the right things, following the public health guidelines, following medical advice, but just being at the wrong place at the wrong time.
Dr. Roberts, when there's such hesitancy around these vaccines that we think of as just essential to get in childhood, are you seeing hesitation when it comes to the COVID vaccine for children? Are you seeing hesitation when it comes to the flu vaccine, as there's an uptick in cases of the flu and COVID this time of year?
Well, what we find is, I think this is not just in Ohio, this is everywhere, is that parents are vaccinating their children for those vaccines that are required to get into school. So those are measles, mumps, rubella, polio, pertussis. Flu is not mandatory for school admission here in Ohio, nor is the COVID-19 vaccine. But those are typical viruses that, many people are accustomed to, and they think they can manage because they see it on a regular basis. They know people who get the flu. They know people who've gotten COVID. But with these other vaccine preventable diseases like measles, we have done such a great job with our vaccine distribution of eliminating it that they don't see it, so they don't think it's necessary to get those vaccines. And so there's multiple camps. There's some people who just don't believe in any vaccines, period. There's some people who are only getting the necessary vaccines. And then there's some people who have read some of the misinformation about what vaccines can do and have associated particularly the MMR vaccine with autism, which we know is not true.
Health Commissioner for the City of Columbus, Ohio, Dr. Mashika Roberts, thank you so much for joining us this morning.